The Associate Director. We are recording the webinar. I'm the Associate Director of Maine Public Health Association. I'll be one of your facilitators for tonight's webinar, Cannabis Use in Adolescence, What Parents Need to Know. And before I jump in and introduce our panelists and go through some quick housekeeping items for this webinar, I'll pass it to my co-facilitator, Leanne, to introduce herself really quickly. So Leanne, want to introduce yourself?
Hi, everyone. Lee Ann Dodge here, and I use she, her pronouns, and I'm the program director of SOPO Unite, which is one of the drug-free community coalitions, and we're here in South Portland. And welcome.
Awesome. So setting the stage for tonight's event, Maine Public Health Association and our partners, who I'll shout out in just a second here, are working to educate people, parents, folks in the public and decision makers about high potency cannabis use and potential impacts on young people. And that includes promoting policy solutions that we think will help to reduce youth cannabis use and encourage the cannabis industry to be more transparent and responsible. So we'll dig into some of that today, and I'm hoping people come away with three key takeaways that our panelists will go into in depth based on their own experiences and expertise. One is that high potency cannabis use today is very different from the cannabis of the 1970s. It has a different set of risks associated with it for younger people, and we'll get into that. Two is I want to make sure parents know that there are some strategies for talking to their, children, young people in their lives about cannabis use and how to go about that. And then three, again, we're engaged in advocacy and encouraging policymakers to adopt policy solutions to reduce youth cannabis use. And I'll flag a couple opportunities there that people can engage in, and we'll have some more at the end of the webinar on that. So let's go through a couple disclaimers for the webinar. This project is supported by the Health Resources and Services Administration, HRSA, as part of an award to the Public Health Training Centers. And as such, the contents do not necessarily represent the views of or endorsement by HRSA, HHS, or the US government. There are certificates of attendance available, and I'm not sure if we're offering credits for this webinar, but if you are interested in that, you can go ahead and ask in the Q&A. So potentially more to come on that, but I don't have much to share on that front right now. And big thank you to our partners. So New England Public Health Training Center, the Maine chapter, the American Academy of Pediatrics, Maine Osteopathic Association, Maine Medical Association, and of course, Maine Public Health Association are co-sponsoring tonight's webinar. So a couple housekeeping items. We are not going to use the chat function for tonight's webinar. We encourage questions. I will say that we got a ton of pre-submitted questions, so we'll have a lot to get to, but we will have a point in the webinar where people can ask their questions live. To do that, use the Q&A function. Don't raise your hand. Don't use the chat. Just use the Q&A. And again, this webinar is being recorded. At the very end, we'll have a super quick survey, just 4 questions that will take less than a minute to fill out, which is super helpful for us and also for the New England Public Health Training Centers grant. Now, for our panelists, I'm really excited to have Dr. Amy Mayhew, child and adolescent psychiatrist, here with us, Althea Turner, social worker at South Portland High School, Martha Jakes, the principal at Biddeford High School, and Jay Orser, who is a presenter with SEED. And I'll ask Jay to share a little bit more about SEED when he gives his opening remarks. And so to kick us off, I'm going to pass it to Dr. Mayhew, who is going to set the stage a bit more about youth cannabis use and potential impacts. So I'm going to stop sharing my screen and I will pass it to you, Dr. Mayhew.
Okay, well, we'll see how this works, because it's always, I feel like every time I do this, it's another adventure about whether it's going to work or not. So let's see.
Yeah.
All right, I'm going to start sharing this, and then I'm going to put it in. Let's see what you guys see. Do you see my slide?
I do. You're good to go.
Awesome. Well, that's a miracle. It usually doesn't work that well. So I'm a child and adolescent psychiatrist. I also see adults. I have to say that I took an interest in this really from clinical experience. And so what I'm going to share with you all is kind of like some of the things that I've learned during the last, I would say, 5 to 6 years working with kids that are experiencing early psychosis and also cannabis use. So I did want to start. I have to introduce with Reefer Madness because I just want to be clear that like my goal is not to be like, oh my God, cannabis is terrible. Like, don't smoke cannabis like that. I don't really have. I was kind of agnostic about cannabis when I first when I was a teenager, I had friends that did it, didn't really bother me, it wasn't a big deal. I really have gotten interested because of my clinical practice and what I see with patients. So as we all know, there's been passage of laws that have made both recreational and medicinal cannabis legal, which has increased people's accessibility to it. There's been an increase in THC content by 6 or 7-fold in today's products compared to like the 80s. There's a lot of different ways to eat cannabis. You can eat it in macaroni and cheese. You can have gummies. Like there's just a lot of ways. There's no FDA oversight. I think sometimes people get confused and think there's some kind of government regulation that's happening. There's not. Even in the states where it's legal, there's not necessarily laws that are really taking much interest in how things are being processed. That is not to say that there are not dispensaries that are doing that on their own, but I'm just saying like across the board, that is not happening. Most people think that marijuana is safe and natural. I mean, most of us that have teenagers grew up in a time where there was a lot lower potency of cannabis, and so it didn't really seem like that big of a deal. And people don't really know what different usage and risks and benefits are. The picture below is a dispensary, which looks really nice. Like I'd like to hang out there. It looks pretty. A little information about Maine and cannabis. So the medicinal dispensaries here first opened in 2011, and recreational dispensaries opened in 2020. Adults that are 21 years of age or older can have up to 2.5 ounces of cannabis or other concentrates or products. Medical card holders can have a medical dispensary or enter a medical dispensary if they're 18 years old. If someone is under 18, their 21-year-old or older caregiver can purchase on their behalf. Cannabis is supposed to only be consumed on a private residence or in private property. I guess that includes your car, because I know when I drive to work, I feel like I smell it. I think I actually smelled it on the way home today. The sale of this past year in 2023 was $217 million. That's a 36% increase over the previous year's amount. And the state has gained $21 million in tax revenue. So I don't want to like be totally naive about the fact that money does play into this. And so, I'm a physician and I want to take care of people. So I want to be balanced about like what is a moneymaker versus what is actually helping or hurting people. And interestingly, the prices actually decreased by 16%. And I think that's really due to the fact that there's so many dispensaries. I feel like I drive to work and I pass like 6 of them. So I can't imagine that like at some point the supply and demand is going to make the prices go down. So this is a youth risk behavior survey. Those of you who don't work in schools may not know that this is something that's asked to be filled out by all high school students. I think you can think on your own about whether every high school student is answering truthfully these questions, but it is a general gestalt about like kind of what's happening in high school, and it is 9th to 12th grade. So I just wanted to look at some trends between different substances. So alcohol use in the past 30 days, that's what this information is. So you can see between 24 and 20%. I really wish some of these graphs had different ages in high school, because I've noticed that 9th to 12th grades is very different. But anyway, this is just kind of a general gestalt. This is marijuana use. So if you go back, a little bit more alcohol use and marijuana use. This is interesting because this has actually changed since the pandemic. So it's a little bit lower, at least according to the survey. I will say that Jay and I were at a high school on Friday, and they all said that 50 to 60% of their friends are using cannabis. So I don't know how truthful this is across the board. And I think it does depend on what population you're talking to. And this is illicit drugs, just to give a demonstration. So obviously this is a fair amount lower than what we're talking about with alcohol or cannabis. Cannabis is a very complicated compound. It is actually hundreds of different compounds. I think people sometimes think like, oh, it's a natural thing. It's, whatever makes me feel better. Like, and there's not really a lot of thought about where it goes into your affecting different organ systems. So this is just a picture showing you all the different systems that are affected. So your immune system, metabolism, muscles, your bones, hormones. I mean, there are different receptors. CB1 and CB2 are 2 of the different receptors. THC actually interacts with the receptors differently than CBD. I don't really have the time to go into that, but if anyone's interested later, I got a whole slide set to talk about an hour. We can talk about this, but just trying to give you guys a brief overview right now. So there is some evidence for medicinal uses of cannabis. So these are the conditions currently where there is some research that proves that there's some benefit. So the first 2 are 2 different kinds of epilepsy that are found in children. So second line means that there's another primary treatment, but this is something that might be useful if your first treatment is not working. There is some data for chronic pain. Really, that is neuropathic pain. So there's different kinds of pain, obviously, but that's where the data is currently. There's some proof for people that have problems with vomiting or nausea in adults. There's some data behind spasticity if you have multiple sclerosis. There's some weak evidence in irritable bowel syndrome. CBD specifically for social anxiety, some weak evidence about PTSD and sleep, and there's really no benefit found for depression. So I just want to make one statement about medical information and research, because I don't think everybody who's not a physician or works in a medical field understands it. But basically what happens is you kind of gather data over time, and the more data you get, the more proof you have that you believe in something. So these things, some of them there's better research, especially with the epilepsy up top. When it says weak evidence, it means that there's like either conflicting evidence in different studies, or it just doesn't feel like a very strong association. So that's what those things mean. So this is interesting. So this particular study is looking at, I'm going to go through a couple studies just because I feel like sometimes we're like, I'm not Dr. Google, like I'm looking at things that are in PubMed, which is kind of a medical database. So I do want to show you that like where the evidence is coming from. I'm happy to answer any questions about this. So really the studies that have shown benefit from smoked medicinal cannabis in particular, and obviously there's lots of different methods, is less than 10% THC. So I want you to think about that for a second. That is very difficult to find in Maine. Like flower, which is what you find in a plant, is usually 14 to 18%. If you're vaping, that can be up to 95% THC. So there really is no medical evidence that shows that any of things are beneficial, like on a long-standing basis. That doesn't mean like moment to moment it's not helpful, but like if you're going to be using this like long-term for your anxiety, not great evidence for that. So there is no legitimate science that validates medical cannabis use greater than 10%. And this particular study was looking at pain, because a lot of people will say that they use cannabis for pain. And they actually looked at different percentages of THC. So 2%, they found no benefit. 4% did find that there was actually significant pain decrease. And then if it went up to 8%, there was actually no benefit. Hyperalgesia means that your pain actually increases. This is why I'm interested in cannabis, like one of the main reasons. So I treat kids, I treat teenagers, I treat people with psychotic illnesses, which I will talk about in a minute. The main issue I have with teenagers smoking cannabis is your brain development. So if you look at the picture on the right, so when you're born, you do not have many neural connections. That's what that picture is. That's the connections between your different like nerve cells in the brain. By the time you're 7, you have like this explosion of connections. And by the time you're 15, they're what we call pruning. So basically it's picking the pathways that are working and that you need and kind of getting rid of the junk. And cannabis interferes with that process. So that's a big problem. So because of its effects on the prefrontal cortex, which is a part of the brain that's dealing with memory and executive functioning, you can actually affect attention, memory, and your ability to kind of manipulate complex tasks. There is persistent change and lower functioning even after abstaining. So there's kind of this idea like, oh, I'm going to use it now and I'm going to stop. I mean, brains are plastic. We have a lot of excess brain energy. So it's not like it maybe will be noticeable, but it is going to have a cumulative effect. There are several studies that show there's up to an 8-point decrease in IQ from using cannabis as a teenager. And there's pretty good evidence that those that start using before 17 have reduced risk of graduating from high school. They're more likely to develop a disorder, meaning that they have an addiction to cannabis, that they have trouble stopping, especially people that are using daily. And there is some evidence for more likely use of illicit substances. Now, I will say, in my experience, there are a lot of people that use cannabis daily that don't go on to do heroin or pills or other things, but it is a risk. So, and there is a risk of more suicide attempts. I want to talk about psychosis for a minute because that's really the world I live in clinically. So I want to explain what that term means. So psychosis is a set of conditions that affects the mind where there's some kind of loss of connection with reality. So that could be hallucinations. You can see things or hear things. You can have delusions. You can think people are following you. You can think that there's, things that are affecting your daily life that can be very real and distressing. Also can change your ability to communicate or think or be able to do schoolwork, mood, sleep, and behavior. Most of the cases occur between 13 and 30 years of age, and THC in particular may trigger psychosis in certain individuals, especially with earlier use and more potent strains. And there has been MRI studies that have looked at the loss of gray matter, which is a part of your brain that shows the volume or decrease with those with schizophrenia.
Hey,
There's
Dr.
just a little
Mayhew,
graphic. Oh,
yes,
yeah.
I'm sorry to interrupt. Can you, I know I asked you to be tight on time, so this is probably on me, but we have someone who's asking for it to be a little bit slower. If you can slow down just a little
Oh,
bit, because you're
no.
sharing so much information, good information, but sharing so much information.
Yeah,
So if
I
you could
will
just slow
share.
down a little bit.
I'll try. Yeah, I do speak fast in general. I will
No
share
worries.
my slides, and so anyone who wants them can have them. So that
Awesome.
will
And
also
we
be
are recording
helpful.
this webinar for folks who are asking.
Awesome. Okay, I'll try to slow down. So prodrome, this picture shows like kind of when you're having psychotic symptoms, meaning you're having hallucinations or things are happening, but you still realize it doesn't make sense. And a lot of people I see that are smoking cannabis that are early, middle school, high school, this is what I see. They're hearing voices, they're seeing things, they're thinking they're paranoid about people in class, but they're like, that doesn't really make sense. The acute phase of psychosis is when you've kind of lost insight and you no longer understand that that doesn't make sense. You really think the FBI is after you. And then the recovery phase is just kind of like when you're in treatment. That's just a brief overview. I'm just going to go through a couple. I don't have a lot more slides. I'm just going to go through a couple other studies just to kind of give people the sense that there's a lot of information out there, because I think that sometimes people don't understand how much information is out there to say that there are some dangers to this. So this is a study in Denmark. Denmark has a socialized medicine system. They looked at a longitudinal population-based study. So they over 7 million individuals. So this is a big study. And they found that because of the increase in potency in cannabis, the risk of you developing schizophrenia went from 2% to 8%. I know that doesn't sound big, but like on a population level, that's huge numbers. So just to show that there's a very clear risk between smoking cannabis and having a possibility of developing schizophrenia. This is another study that's well known. This is in the Lancet, which is a British medical journal. It looked at 11 different countries, looked at daily use and high potency use, which is again defined as THC over 10%. Again, in Maine, it's hard to find something under 10%. They found that people that are using high potency are almost twice as likely to develop a psychotic disorder. And people who are using high potency daily are 5 times more likely. So very increased risk for you developing schizophrenia or a psychotic illness. So this is a point that I really want to put with parents to talk about with your kids. This is what I talk about with my patients a lot. When people have psychotic symptoms with using substances, that is you are at a much higher risk than other people in the population. So if you have psychotic symptoms using cannabis, you in particular should stop, because you have a 30%, almost like a third risk of developing either bipolar disorder or schizophrenia. And the greatest risk is not with methamphetamines, it's not with cocaine, it's not with opiates, it's cannabis. So just to keep that in mind, if you use younger, you have a greater risk. And then also self-harm. So hurting yourself, suicide attempts is also increased risk for that particular population. I've got 2 more slides, maybe 3. Some of the other aspects. So again, age of onset is really important. So like I try to get people to delay use. So use when you're older, don't use as much, don't use as high potency. Those are all things that you can control. Exposure to childhood trauma, if you're using other substances, and then obviously genetic factors. If you have psychosis in your family, you're more likely to have a problem. So to distill these points, biggest risk factors with cannabis for psychosis or schizophrenia: using before the age of 18 is best to wait till your brain matures, which is after 25. I would say the later you can wait, the better. There's a dose-dependent risk. The more you use, the higher risk you have. Any use at all is a 40% increased risk of having psychosis. And then again, the more you use, the more often, the more severe. And those who do have some kind of family history, if you have schizophrenia, bipolar in your family, you're 2.5 to 10 times more likely than other people to develop a psychotic illness with using. So just briefly, it's also linked with bipolar disorder and having manic episodes. There's not been great analysis about like whether or not it's going to help with depression. That's what I hear from people. There's actually an increased risk of developing a depressive disorder. And anxiety is a reason I often hear people say why they're using cannabis. But there are not great studies showing that there is a link between using cannabis and helping anxiety over the long term. Because really what I find it does is it just kind of masks the symptoms. I'm actually going to stop here because I think it would be better, to hear from the rest of the panel than me to show that slide.
Thank you, Dr. Mayhew. And I just want to note really quickly, you said the medical benefits are associated with under 10% THC. And
Right.
just to note for folks, right now there is no potency cap for edible cannabis products in the medical cannabis market. There's no potency cap. So we'll talk more about that, I'm sure, in a little bit. So Martha, I'm going to pass it over to you to talk about what you're seeing at Biddeford High School. So over to you.
Thank you, Matt. Good evening. My name is Martha Jakes, and I am the building principal of Biddeford High School. I'm also a licensed social worker that's worked in Southern Maine for the better part of 15 years. So I've seen the effects of cannabis use in adolescence, both in the school and outside with older clients and those who have kind of worked their way through. And what we're seeing aligns exactly with what Dr. Mayhew has said. You know, we've had a lot of students that, especially post-pandemic, that are self-medicating with marijuana, that are thinking that it will decrease anxiety, helping to calm their brain, helping to afford them the ability to walk through the door in the morning. And really, when we, have a little more education around it and they understand kind of why they're feeling and how they're feeling the way that they are, we're learning that may not be helping them. I think one of the big changes that we've seen is the delivery methods that students are using. In the past, once in a while, you'd get a call that a bathroom smelled like marijuana, and we'd go down and we could kind of drill that down. And I think what we're smelling now is a lot of vaping. The devices that students are using are very tricky. I mean, anything from what looks like a water bottle with a hole in the bottom to a pen, a lot of fruity and vanilla, watermelon type smells that we are, mask the smell of the cannabis. We have really, we've been tasked with the education piece around it. We are not saying that no, you can never use it. We're also educating a lot around the legal, students argue all the time, well, it's legal. Well, it's legal. Right. It is legal for certain age groups in certain places. And so the education around that piece, we're fortunate that at Biddeford High School, we have an advisory program 5 days a week. So we do some lessons throughout that, and we're able to do some education. We did feel a need to hire a full-time substance abuse coordinator here, which we had not had in the past. And we've really looked at a lot of the discipline around use. That's one of the main things that has changed is, a kid used to be caught with marijuana and be suspended for 10 days out of school suspension. And what we really learned and we've seen is that the education and restorative practices around that use are way more beneficial in the long run. So we've developed a restorative room where we do an education piece. We have staff members that are trained in educating students, and we've really tried to take that approach in making sure that students understand, the ramifications of the decisions that they're making and how this could affect them long term. I will say too, that having been a social worker and gone, through that education process for a long time, it was, you don't diagnose a student with a psychosis, bipolar disorder, schizophrenia until they're at least 18. And we're seeing more and more students being diagnosed at younger ages. And the majority of those students, coincidence or not, are students who have had extensive cannabis use histories. So it's interesting to see that aligns with that.
Yeah, thanks for sharing that, Martha.
Sure.
And again, for folks, we'll share the recording, and Dr. Mayhew has offered to share her slides after this webinar. You've gotten lots of requests for your slides, Dr. Mayhew. So let me pass it to Jay to share his experience here. So Jay, I'll pass it to you.
Thank you, Matt. My name is Jay Orser. I am a person in long-term recovery. I work for an organization called SEED, and that stands for Students Empowered to Independency. We are a group of students who talk with other students about addiction, and especially about cannabis, because so many kids are using. We have made about 100 presentations in the last 2 years in Maine schools. We also have a Voices of Hope series is what it's called. And we have over 11 hours worth of video footage of people sharing their experience and stories with using cannabis and other stuff. But we are in the process right now of working on an episode 11, and that will be aired in February, and that will be called The Cannabis Deception, and that will be aired on Maine Public Television.
Thanks, Jay. Althea, let me pass it to you, and after Althea gives her opening remarks, we will jump into the Q&A. So Althea, go for it.
Hi, everyone. My name is Althea Turner. I am a social worker at South Portland High School. I was asked to join this panel by Leanne Dodge, the lovely Leanne, who we're very fortunate to have housed at South Portland High School with us. My social work career started in the harm reduction sphere of things. I worked on the street in San Francisco with folks who were using injection-based drugs, working on public health and really supporting the health of those folks. And doing disease prevention with specifically Hep C and HIV prevention. I then entered the world of education, which I loved, but I quickly realized that I was much more passionate about social emotional growth rather than academics, and wanted kids to have a teacher who loved academics, and that led me to social work. So I have been practicing here at South Portland High School. This is my second year. And I've had the privilege of also working at the Preble Street Teen Center and also at Maine Medical Center in the ICU. So I have kind of a dual lens of public health background and educational background. Right now, I have the privilege of working with many young people in all kinds of different scenarios. I'm a general education social worker, which means that I can see any student at any time for anything. And that also means that I often work with students who are using substances. Like Martha was talking about, we at South Portland, thanks to the work of Leanne and SOPO Unite, have a restorative policy around substance use violations at school. Part of that policy is that if students are caught using or if they have substances on them, one of the steps that they go through is they meet with a social worker. And the goal of that meeting is to provide education and to assess where that student is at within the spectrum of use. So I have met with students who have used for the very first time and have been caught, like Martha was saying, in the bathroom. I've spoken with students who are much further progressed in their stage of use and are using cannabis every day, multiple times a day, and are more in that addictive phase. What I have mostly seen is that the young people I work with are starting with cannabis or alcohol as the substance of choice. That is kind of where they begin their substance use. By no means am I arguing that cannabis is a gateway drug. That has been disproven, but what is true is that cannabis feels very accessible to young people. They see it as something that is easy to find and to get, and they also see it as much lower risk than other substances, and so they engage in that risk-taking behavior. So tonight, that's the lens I'll be using, speaking just from my experience with young people, specifically at South Portland High School, but also wanted to just give the background of kind of my lens of how I work.
Great, thank you. And so I have a question for if each of you would respond to this. What advice do you have for parents who want to have meaningful conversations with their kids about cannabis use? What advice would you give to parents? Like, how do you talk about this with your kid? So whoever would like to start, I'd love to hear from each one of you.
I'd love it if Jay talked first.
You want me to kick it off? Oh, put me on the spot. When I speak to youth, my role as when I am speaking to someone that is considering or just wanting to know about use and recovery, it's more about personal experience and showing, this is kind of what it did to me. Just having those tough conversations, I think, is what's very needed. Me and my mother have had very tough conversations, especially when I was in personal use. She'd sit me down and I would have a drug test. It was just about, letting her know, having those tough conversations. It's hard, but it's very needed to know what your kid will be doing later that night on a weekend.
Okay, so be brave and have the tough conversation, sounds like. Who else would like to share? What advice, what should parents say to their kid? How to have this hard discussion?
Sure. I think one of the things that I do here is work with families and help educate families. And I think one of the most important things is, you know, oftentimes parents can be caught off guard, especially if there isn't family history. And I think just reminding parents that coming from a place of compassion, love, caring, assuming best intentions, really educating the students, and doing so in a non-judgmental and supportive way, letting them know that you're there for them. I think sometimes, you know, with a quick reaction, a student just pushes away from that. And I think it's really important to make sure that you're showing that love and compassion to your child.
Thank you. Althea, Amy, what should parents, how to talk to them?
Yeah, I'm happy to double down on that message from Martha. I think it really cannot be overstated the power that a non-judgmental conversation can have. And that said, I've worked with many parents who, like you just said, Martha, are hit in the face with, oh my gosh, my young person is using cannabis and I didn't know about it, and understandably have a reaction that is not always calm. And so I think that it's also important to remember that if you did have a reaction that wasn't perfect, which is expected, you can always go back to your young person and say, hey, I was really scared. And let that be a leeway into being vulnerable and talking to them about why you're scared. What are the risks associated with cannabis? And what are also the things that you know to be true about why somebody would use drugs? Validating the reasons that a young person might decide to pick up a drug, whether it's for self-medication, it's for social approval, whatever it is, you want to strike that balance of validation and also expressing concern with transparent education. The other thing I'll say is that we know that adults in general, trusted adults in general, are key for teenagers' success. That is not always apparent, just based on where adolescents are in their development. A parent is not always the first person that they turn to when they are making risky choices. So I would encourage folks to encourage your children to get in touch with a trusted adult, whether that's somebody at school, an aunt or uncle, a sports coach, really anybody that they feel like they can talk to, so that they can have that honest conversation.
Thank you. Amy, thoughts?
Yeah, so a couple thoughts. Like, I think it's a delicate balance between being non-judgmental and giving a clear message. I actually think it's important for adults to be like, it's not okay to be using at your age. Now, that does not mean I have two teenagers. I expect they're going to do things I don't want them to do. Like, I know that that's going to happen, but it's actually, I mean, there's pretty good research to show that if you as the adult say, that's not okay, I don't want you doing that, you know, and then also can come back and be like, okay, I know that this is happening. Let's talk about why and how do we figure this out? Because I also, you know, hear of like people at Thanksgiving that were sharing cannabis with their kids. Like it's really just not okay. Um, you know, adults are different. Adults, you can do you can do whatever you want as an adult. I'm not really worried about that as much. And then, you know, Althea was saying, you know, figuring out the reasons for why, like, are there other ways that we can deal with this differently? And I have a lot of conversations with kids. I mean, I had a kid I saw today who's got schizophrenia from smoking cannabis. And so I was like, okay, what was it doing for you? Why were you doing it? Are you still doing it? How do we figure this out? Like, I'm going to express my opinion clearly about what I think they should do. And then I'm going to still be with them with the choices they're making. You know, so I think that's a delicate place to be sometimes.
I jump in here, Leanne. This is all super helpful and interesting context. And I think one follow-up question I had is a couple times folks have said, and Dr. Mayhew just said, it's not okay at your age. And so can you, maybe Althea, I'll pass it to you for this one. How do you strike the right balance of the delay versus the old school dare, just say no, which we know is not super effective based on our experiences. So how do you strike that balance of what Dr. Mayhew was just getting at, like understanding the longer you wait, the less, you know, risk there's going to be. So how do you communicate that to young people?
I think you communicate it exactly how you just did. You share with them that exact message. I think, you know, teenagers respond, almost every teenager I've ever worked with has responded really well when I'm direct with them and when I treat them as somebody who is an emerging adult and who is about to have a lot more power over their decision making. And so the more education I can possibly provide is really the answer that I'm always going to give. The young people that I've met do not, they understand that there are risks associated with cannabis use. Many of them who are really embedded in their cannabis use do want to quit, but are finding it incredibly difficult based on their social spheres or on the reliance that they have, or the perceived reliance that they have, to kind of self-medicate. However, they are not, they're they're not immune to understanding the effects. And when I really sit down and when I'm able to approach with a non-judgmental start, they are often able to say back to me, I recognize that this is risky. And so starting there can then allow me to say, let's look at some educational materials. Let's look at the risks that this can incur, and to say that loud and clear. That can often enable youth to feel more empowered to make the choice themselves. Because if, of course, I say, don't do it just straight up, there's going to be a lot of pushback, which is totally fair. And sometimes that is the route I go, but I also kind of tailor it to the student who's sitting in front of me.
Glad you said choice, Althea, because that's a good segue for my next question. So, this isn't just about personal choice. As the Public Health Association, we think a lot about the systems people are living in, the communities they're living in. And we know that there are, policy decisions made at the state level that make cannabis more accessible to young people, make it less safe, less transparent for anybody using it. And I think the medical industry has some ambiguity there, and I want to ask Dr. Mayhew about this. So what are the requirements for getting a medical cannabis card right now in Maine? Let's start there, and then I'll ask a follow-up.
Yeah, so I don't prescribe medical cards. I'll just be clear with that from the outset. Like, I don't believe in it. I think that, and I think that like I said, there are some benefits to it, but there's also benefits to fentanyl. So that is also true. So like, I don't need to necessarily prescribe it myself. There is not like a list of conditions you need to have to get cannabis. So, and I will say that there are those out there that I do not think are doing a great medical exam about the decisions they're making when they're prescribing people's medical cards. And I'll leave it at that. I think that it's very challenging as a medical professional, because I do think that there are some people that could be helped by it. But, myself as a child and adolescent psychiatrist, I'm not prescribing to anyone under 18 pretty much ever. And and in my current job, I would not do that to people over 21. That doesn't mean that there would not be a case for it in some circumstances. But I don't think there's good regulation at all.
So, Jay, can I pass this to you really quickly? Because we've talked about this from your own experience. How easy is it to get the medical cannabis cards based on your experience in high school?
Personal experience, I signed up to get one when I was in use, and luckily I was going into detox the day of my meeting, so I wasn't able to have it. But of all of my friends and people that use, they went in, well, not even in, they joined in on their computer or phone. They talked to the person that they were giving the evaluation to or whatever. And the call didn't even last more than 10 minutes. I wasn't part of the conversation. I wasn't listening. I don't know what was said or what they said they needed the card for. But they were in and out on that call for less than 10 minutes, and they had a medical marijuana card on the way.
Yeah, and one of the things that we're highlighting a lot right now is the fact that there are differences between the adult use program and the medical program. One of which is that the medical cannabis industry it's not required to test their products for contaminants. So for pesticides, heavy metals, mold, and that's something we find pretty concerning. If people are using it for medicinal purposes, we should have testing in place to make sure the products are not contaminated with harmful substances. So before I go down a rabbit hole on that, Leanne, do you want to ask another question? I'll encourage folks who are already adding their questions to the Q&A. Please keep doing that. We're going to start to weave in some of the live questions with some of the pre-submitted questions that we've gotten. So keep adding your questions to the Q&A.
So my question for anybody that would like to respond is, what are young people's attitudes towards cannabis right now? What's the word on the street when you're talking to someone, whether they're using or not? But what's the attitudes that you're hearing from young people about cannabis? So whoever would like to start.
Sure, I'll start. I think, for the most part, kids don't think it's a big deal. What's the big deal? Kind of as I alluded to earlier, it's legal. We can do it. Our parents did it. We know a lot of people that have done it. It's fine. It's not a gateway drug. It helps my anxiety. It helps, if I do it once in a while. And I think as we've discussed here tonight, and as our job as educators is to our children, is to make sure that they're understanding that the cannabis of today is not the cannabis of 1980. The potency, the regulations, we've unfortunately seen kids that we've assumed maybe overdosing on something stronger or, more stereotypically stronger. And when we get down to it, it's cannabis that they've overdosed on, and we don't know. Without the regulations, we don't know if things are, contaminated or being laced with other things. And I think that that's scary quick, right off the bat for kids. And then they're also quick to forget that and kind of slide right back into it's not a big deal thing. So, Jay spoke at our school last year. We try to have a couple, times per year where we have other students come in and talk to our kids and like, hey, here's the reality. Like this is addictive. This can happen. This has ruined my life or really changed a course. And you do have choices to make. So what things can you control and what things can you not? And really focus on your decisions and, making sure that kids realize that it is more serious and it is different than what their parents may have used years ago.
Could I jump in just for 1 second? I just had
Yeah.
to say something listening to you, Martha. Like, like when you become a physician, you make an oath to do no harm. And I just have to say, like, in no other part of like public health or, like medicines that are on the market, things that have been approved that we're like promoting as medicinal, is there like the total lack of regulation, studies? Like, I mean, it's kind of insane, I have to say. And I am not anti-cannabis. I mean, I have friends that smoke cannabis. That's fine. Do what you want. I just want to point out, though, that like really we just have like let loose this social experiment and we really have no idea where it's going. And, it's just, I feel like we're not taking good care of each other by doing that without being more thoughtful.
Yeah, and again, we talk about policy, and last year the legislature passed a policy that allows unproven patient testimonials to be used as advertisements on medical cannabis. So again, this is about making sure the industry is as transparent and responsible as we can make it. As Dr. Mayhew said, we're not anti-cannabis. That's not what we're here for. We're here to talk about how this is impacting young people. I see a nice cat, Althea. Before we jump into some of the live questions, any other final thoughts on Leanne's question here about perceptions of use for young people?
I'll just
Okay,
mention one.
go
I'm
ahead.
going to mention one little quick thing. The youth, they look up to the role models. So if I'm a freshman or a sophomore and I'm watching someone on the senior varsity soccer team play soccer, and it's like, oh, I want to be like him. But then you go see him maybe smoke some weed. It's like, oh, that's kind of, or you see a parent you say, the youth look up to the role models. So.
Yeah, thanks for saying that, Jay. So I want to go to one of our live questions here, which I'm going to direct to Althea, but other folks can chime in as your expertise is able. So is harm reduction a viable treatment method for cannabis use disorder, or is abstinence-based treatment preferable? So Althea, do you want to start? And then maybe Dr. Mayhew, if you have thoughts on this as well.
Yeah, I mean, I think that's a question. There's a lot to it, and that's a question that I also could go on a long-winded spiel about. I think the answer is that the part of abstinence that is beneficial is, of course, we know that the lowest risk option is to abstain. Right. We know that is the lowest risk option for young people. That's part of why the delaying is a really good strategy, to say to a young person, if you can delay, that is partially abstinence, right? That's abstinence based. However, we also know there's a huge swath of evidence that abstinence based education, kind of the traditional scare tactics, what we remember from DARE programs, for example, those don't work. They really do kind of shame. And most everything that I've worked with and seen that works is really based in that non-judgmental space. And that abstinence model is important. And I want to mention a lab that I think does a really good job of talking about that kind of walking that middle ground of kind of talking about abstinence and harm reduction. The Stanford Reach Lab, Stanford Medicine does this program. The Reach Lab, they do a lot of education and research into youth substance use, and they have some really awesome resources. They kind of toggle that line between talking about delaying and also talking a lot about harm reduction. And in my own work, just speaking personally, I really, I work with students to remind them of the risks, like we've talked about, of cannabis use and to encourage them to delay. However, as a social worker at a public school, I'm not usually seeing the young people who are not using at all. I'm mostly seeing youth who are already engaged in substance use and are often pretty far along in that continuum. And so in that, in my relationship with them, my priorities are always safety first, because I need that young person to be safe to continue to have this conversation with me, and then to really talk to them about those risks, and to give them empowerment and space to make their own choices. But I think it's a tricky question. I'm sure other panelists have thoughts, and I'd love to hear their responses.
Yeah, does anybody else Martha, I know you just hired a substance use, I can't remember the exact title, manager. So any thoughts from their experience so far in Biddeford on this question?
Sure. I think that we have, historically worked with outside agencies that we've contracted with to do some work with our kids. This year, we were fortunate enough to be able to hire someone full-time to be here. I think that a lot of the work that clinician does is specific to education, harm reduction with an end goal of abstinence, knowing that in some cases, we're looking at progress, not perfection. So, we're trying to, as I've, said many times, trying to educate, looking at connecting students with support groups, with other students who may have gone down a similar path and decided to make some changes, and really, hoping that they will make the decision that no use is best for them. And in the meantime, encourage them and support them as they try to reduce their use.
Thank you. So we have mostly Maine-based folks on this call, but there is a more regional and I think even national audience. And somebody asked about Hawaii. It seems like they're on track towards legalization of recreational marijuana. They've legalized medical use for a long time now. So how should prevention specialists and adolescent treatment providers prepare for this shift, especially based on our experience here in Maine? As Dr. Mayhew said, we're now seeing this social experiment unfold over the last several years in Maine. So any advice for other states that are opening up access to cannabis legally and how we can make sure, they learn lessons from states that have already done it? So Dr. Mayhew, how about I start with you?
I mean, my main request for both our state and other states is that they limit the potency of the THC. Like, I think that like needing to stop, I mean, people are going to continue to smoke THC and that's okay. But I think that like the risk is really the dose dependent relationship. So if there was a way that they could advocate for like some kind of top number on how potent whatever products they have out there, I think that that would do a lot of harm reduction. And one thing back to what Martha was talking about was kind of like talking about kids in school. I think that sometimes parents don't put enough, because I get to see a lot of parents get into battles about like drug testing and stuff, and like, really like, what are you going to prove if your kid's smoking? Like, that's okay, yeah, now because you already knew. Like, it's more about natural consequences and like finding like, are there things you can get your kid involved in so they're not going to use? Like, if they're working or if they're like whatever whatever activity you can get them in to like have them not have all of that time that they're going to be using. I think sometimes that's a better kind of like use of your time.
I'm wondering, Dr. Mayhew, if you could talk a little bit about what treatment looks like for someone with cannabis use disorder. What are the ways that someone could address this? And then another question just for people to put in your brain. I know we don't have much time, but how do you talk to parents who don't think it's a big deal?
Yeah. So for your first question, I might ask Jay for some help on this one, but like there's, first of all, not a lot if you're under 18. So that's really challenging. I mean, Day One's got a program, Pine Tree Recovery is a program, but there's really not a lot. There's, you really have to be 18 to access a lot of the treatments. So that's unfortunate. We we do have some LADCs to like help with some of these things, but really a lot of it we're doing it in primary care. I mean, primary care put out a whole series last year, which they're still doing this year to try to help with some of this. I think that those of us who are not addiction specialists, which I am not, have just are like learning on the fly because we have to, because there's not a lot out there. So it's a lot of conversations about what impact what your uses is having in your life, and is it something that you feel like is causing problems, because nobody's going to stop because someone tells them to. You're going to stop because there's some problem that you're having. But I'm going to ask Jay to kind of add in for his thoughts.
Yeah, so I was 18 for a month, and we are seeing a lot of kids that need a lot of help. And if you are not over the age of 18, it's very hard. As Amy has said, Day One, Pine Tree. I know there's some online stuff you can do, like an IOP. I know that Pine Tree is doing that. But for what I did, I was 18 and I went into rehab with adults. And I did that full treatment plan. There are 100% way more options for people that are of the age of 18. But the kids need our support. So we're hoping and definitely start to have some more sources and options available for kids that are under the age of 18.
And back to your second question, Leanne, about what I do with parents that don't think it's a problem. I just show them the data. Like I've got a spreadsheet, I've got a paper that I print out from the Yale early psychosis program about kind of the risk, and granted that's the area that I live mainly, but I think that most people don't want their kid to have schizophrenia. So it's usually catches people's attention. And just talk to them about, like that. Do you really, I mean, the thing that I come back to too is like, do you really want to be teaching your kid that you have to always either be altered or entertained? Like, is that the lesson we're trying to teach people? Because I don't think that's a good lesson, because that's impossible.
Can I ask Martha to start with you and then Althea or Leanne as well? So I'm really curious about how schools are tackling this. And Martha, you said that you had Jay come in to talk. How are you reaching parents with some of these messages? And we got a bunch of questions related to that in the chat and pre-submitted about how do you reach parents? How do you educate them? How do you get the materials? So how are you doing it in your school right now? And what do you need to be successful in doing that from folks like us, right? People who are in the public health community? How can we support you in that goal? So Martha, I'll start with you and then pass it to Althea.
Sure. Parental engagement is hard across the board, whether it's about, substance use or, what assembly is coming up next. So last year, when Jay's group came in, we have 900 plus students here. We did a parent Q&A night and we had 4 parents show up. So we had blasted that out on social media. We had sent mailings. We had put it on, I do a monthly newsletter to families. And that was the return that we've gotten. So we do have a parent group that we're working with in increasing engagement. But I don't know what the answer is. I think we have the information. Parents, the feedback that we've gotten this year when surveying parents what the best way to get information is, and we know that short 30-second or less videos, quick digestible items, rather than me emailing out my newsletter, I was asked to send a text link so that they can click on it and read it on their phone. Okay, it's just, we're just in this day and age where it's really short bits of information that are more digestible than long drawn out things. So We'll continue to survey families. We'll continue to send it out multiple ways. We deliver it through kids and their advisory groups. We know that some families are engaged in and participate in the kids' Google Classroom, so we'll put links there. You know, and we just keep trying.
Any quick thoughts on that, Althea?
Yeah, absolutely. I'll let Leanne speak to our restorative circle because she's been piloting that. But we do have some stuff for parents going on. We've started a series of family nights at South Portland High School this year, which we are exploring a range of topics. But we're hoping to do one specifically on substance use, and that is something that we are doing. Like Martha said, it is really hard to get parents. Something that we have been working on is really breaking down those barriers to accessing this type of event. We have many young people whose parents have a hard time with transportation. So getting financial support, frankly, from outside organizations to do things like provide dinner, provide transportation, to really incentivize a community-led event that isn't just asking parents to leave the time that they have to relax to come to the school. And the other thing I'll say is that the most success that I've had with parents is when I build a relationship with them. I'm fortunate to be able to do that in my role, but I think the more one-on-one conversations parents are able to have, whether it's with a principal, a teacher, a social worker, whoever it is, I think that often hits home a lot better. And when you're able to talk specifically about their child and what it is that they're seeing with their child, you can get farther in a conversation with education.
Awesome. Do you have any quick things there, Leanne, since Althea's, and just quick because we're going to wrap up in a couple minutes?
Yeah, so just know that any adult in a community that has an impact on youth are the ones to educate about this. So again, coaches, teachers, parents, aunts and uncles, all those people. A weird thing about the brain is around 15 or so, your young person often stops listening to you, but they often listen to their friends' parents, which is like, oh gosh, so it is that whole community approach and not just, like, yeah, whatever, dad, stop knocking. But that's the important thing about this being a community approach, that all those people giving a message about dare to delay, not never, but not now, those kinds of things, instead of like, it's from the devil, never do it, or it's scare tactics, that doesn't work with the young brain. So again, educating everybody, because your young person might not be listening to their own parent, but they are listening to their coach or their one teacher that they really dig. So that's just the broader approach to prevention.
Thanks, Leanne. So a couple quick things before we close out. We are about to launch the evaluation survey. Again, it's 4 questions, takes less than a minute. Please fill it out before you jump off. We had a question or a comment in the Q&A about how do we educate policymakers about these issues. Really glad somebody asked that because that's what we're here for. We just put a link in the chat that you can fill out if you want more information about MPHA's advocacy efforts. We're prioritizing educating policymakers in the Maine State House about high potency cannabis use in young people, and again, highlighting policies that will increase transparency, safety, responsibility in the medical cannabis program in particular. So please fill that out. You'll get more information from us. So while people fill out the poll, I'll just pass it to each of the panelists for closing thoughts. The one thing you want to make sure parents take away from tonight, and I will pass it to whoever looks the most ready. I'm just going to call on Martha. Go for it. Yeah.
Sure. I think don't be in denial. I think our kids are using. I think it's important to educate. It's important to love. It's important to share a clear message, and also to be in communication with your schools. Ask how you can help. Ask how you can be involved, and don't hesitate to reach out. You're not a burden. We want to partner with you.
Okay, Dr. Mayhew.
I don't know if I have any words. I feel like I've all worded and wisdomed out, but I feel like, I just feel like it's really important to, pay attention to what our kids are doing and help them make healthy choices. I guess that's kind of my big picture question thing.
And Jay, how about you?
Have those difficult conversations, talk to the other parents, see what's going on in the community. Uh, you know, it's about it, what I got. Yeah.
And thanks for sharing your story, Jay. Althea, you can close us out.
Um, I think my biggest message to parents as somebody who is not a parent is be kind to yourself. Meeting parents and watching parenting, it is incredibly challenging. The things that young people and adults are up against in this day and age are really, really large. The steep uphill climb. And I have yet to meet a parent who doesn't want the best for their child. Know that you are doing your best. There are many adults in our communities. We're very lucky in Maine. This is a strong community-based place. There are people who want to help you and your child, but know that it's not going to be perfect. And really, I just encourage folks to be gentle with themselves.
I will take that to heart as a still relatively new parent. I definitely need to be gentle with myself, kind to myself. Yeah. So that's a great place to end it. And again, thank you to our panelists for joining. Thanks to all of the attendees. We'll send out the recording afterwards. We'll also reshare that link for folks to engage in MPHA's policy efforts on cannabis. We could definitely use all of your help. And thank you all again for joining us. Have a good rest of the night.